All right, so we're in chapter 10 on motivation and emotion. And this chapter is certainly not as intensive as the last chapter on chapter 9. Please let me know if you all have any questions, if you'd like to meet individually over Zoom, or if you'd like to talk over the phone, or you'd just like to shoot me an email about any questions, don't hesitate to do so. So when we think about motivation, we cannot separate that from the concept of emotion. So you're always going to find that in any psychology textbook, these two concepts go together. When you think about what motivates you, emotion plays a fundamental role. Whether it be you're motivated to do something that makes you feel good, or you're motivated to avoid something that's arousing negative feelings. Maybe you feel anxious, and so you're motivated to address those feelings that make you feel anxious. Maybe you're anxious about an upcoming test in a class, and so that anxiety then motivates you to study. So these two concepts are very much intertwined, as are the underlying brain structures that are related to them, and you learned about in chapter 2. So let's take a look first at intrinsic versus extrinsic motivation. When you think about intrinsic motivation, you should think about intrinsic motivation being what is coming from inside of us. So the motivation to do things without having to experience any sort of external reward. So these would be motivators such as, a feeling of autonomy, a feeling of mastery or purpose. So when you think about learning new things, you might in some ways be motivated by the reward of doing well in school, but sometimes you're just motivated by mastering material. Would you agree with that? Do you think you're motivated in that way?
Yes, I love learning new things.
Yeah, me too. And I find that like there's a feeling that you get inside that it feels better than probably any external reward, or most external rewards actually could. And so the sense of personal satisfaction can be very motivating. Extrinsic factors include things like compensation, like when you get paid when you go to work. Also punishment. So punishment we often think of when we associate with children, but punishment could be having a negative consequence because you are driving too fast and you get a speeding ticket, or maybe you overeat and then you feel sick to your stomach. And so these are extrinsic motivators. And then rewards are, of course, might be you think that when you are doing really well at a sport, you're going to be rewarded with something, maybe with recognition. I know for my kids, they are very intrinsically motivated to play soccer. They don't talk much at all about extrinsic motivation, but they really do like getting medals and getting trophies. They're meaningful for them. But I wonder if we're only motivated by extrinsic factors and not intrinsic factors, what happens when we remove those extrinsic factors? What happens? If you remove extrinsic rewards, what's going to happen if you're not intrinsically motivated?
You might, the intrinsic feeling of gratification might slow down.
Yeah, okay, so think about this. If I'm not intrinsically motivated, like if the only reason that I study my spelling words, let's say, is because I know that when I do, I'm going to get $1 for every A I get on a spelling test, or $1 for every word right. Now that would be something, because that would be like $12 every spelling test. And if that's the only reason I do it, and then my parents remove that reward, what's going to happen to my motivation?
You won't have any.
Yeah. So we can think about how extrinsic rewards can be motivating, but the problem with them is that they can be difficult. It can be difficult to sustain the motivation when we remove them. So when we can create intrinsic motivation, that's much more ideal, because then we don't have to have those extrinsic factors. So if we want to transition from extrinsic motivation to intrinsic motivation, We need to help individuals if we're talking about children, or if you're talking about patients, like in, let's say, medicine compliance, or any individual, adult or child, to associate what they're doing with that intrinsic feeling or experience by pointing out the sense of mastery, by pointing out that sense of purpose. And for many of us, we don't need that pointed out. But when you're a small child and you're used to, perhaps getting extrinsic rewards, or maybe you really don't like studying for spelling, and so it's really hard for you to do it unless you've got something motivating you, like that extrinsic reward. The parent, the educator, needs to help to tie that positive behavior to intrinsic motivation. I want to point out too that when we are intrinsically motivated to do something, when extrinsic rewards are introduced, that can result in a decrease in intrinsic motivation. So a lot of studies suggest this. And here's an example. Let's imagine that you're an artist and you love painting. It's just the thing that really brings you so much joy. And let's imagine that someone has said that they would like to start paying you to create paintings for them. And so you're thinking, wow, this is great. I can get paid for something I love. Well, then let's imagine that they remove the payment. Let's say they say, I just don't have the money anymore. I love your art, but I can't do it anymore. What do you think is going to happen to your overall motivation to paint?
It would have been decreased because you're not receiving compensation for your art.
Yeah, and so what you were originally very motivated to do, you were really motivated to paint, to do your art, right? You loved it. And so you were really motivated to do it, and the extrinsic motivator became somewhat of a distractor. And now you can see how, how extrinsic motivators not only are a problem because they can be removed and now we're no longer motivated, as in the case of solely being extrinsically motivated, but extrinsic motivation can be a distractor from what we were originally intrinsically motivated to do. Extrinsic motivation can reduce creativity too. You're the artist and you're thinking, if I paint this many paintings, I can make this much money. So maybe I can, take a little less time here or a little less time there. And so we might see a decrease in creativity. So we have what's called the over-justification effect. And this is what we're talking about here, where intrinsic motivation is diminished when extrinsic motivation is given. And so, as I mentioned a moment ago, like painting, when we're doing something that we love to do, like here we have icing cakes, and it becomes our job, our intrinsic and extrinsic motivations to do it might change. So when we're receiving motivation like being paid, we might lose the motivation to do it just for enjoyment, and especially if the payment is removed, okay? So I also want to point out here that some types of reinforcement like praise, that can increase motivation, intrinsic motivation, especially when we are tying that to pointing out how that, when we're tying it to those factors related to intrinsic motivation. So a child does well on a spelling test, they're receiving an extrinsic motivator like praise from a parent. And then when the parent's praising them, they're saying things like, I am so proud of you for how hard you worked. Wow, look at how great your handwriting is. And so that child is then developing that sense of internal, that sense of mastery, where they recognize they've done something well. And now they're tying those two together. While we're here, I want to point out something else as well. And this ties into your last chapter, but it's more directly related to motivation. I want to point out that when we want to motivate behavior, especially if we're thinking about motivating behavior in children and in adolescents, it's so important to focus on the process and not the outcome. The outcome is important, but if we're focusing on the process being how hard you work, how much you focused, those are things we really want to see in children and adolescents, right? We want to see them working hard and focusing. If all we do is reinforce when a child does something right, then they're focused on always doing something right? Because that's what they want to get. They want to get that reinforcement. And yeah, you want the child to get things right. You want them to do well on their spelling test. But here's the problem. When a child believes that they can't do something right unless it's easy, okay, and they know how important it is to do something right, are they going to choose an easy task to pursue or a hard task?
Easy.
Yeah, they're going to choose an easy task. And what do we want kids to do? Do we want them to pursue the easy path or the challenging path?
And challenge themselves.
Yeah, exactly. And so we want to focus on being proud of hard work. Effort is so important. If the outcome, yes, it does matter in many instances. But when we, if we really want to develop a motivation to pursue challenge and a motivation to persist, we need to focus on recognizing that and rewarding that and tying that also to intrinsic motivation. We also have what's called an instinct theory of motivation, and this was proposed by William James, and he said that behavior is driven by instincts. So, for example, he suggested that a mother is driven or has an instinct to protect her baby, or he used the urge to lick sugar, like we want something sweet, it's instinctive, or hunting prey. And it received criticism because it ignored the role of learning in shaping behavior. So when we think about instincts, instincts are actually much more complex than what William James suggested. Instincts are species-specific patterns of behavior that are not learned. So mother's protection, a mother protecting her baby, how she protects her baby, is that going to vary from mother to mother? How she protects the baby?
Yes.
Yeah, it's going to vary, right? And so because there's variation, this tells us that there's probably some learning going on. There may be some genetic influences too, but it's not species specific, and it's not a very specific series of responses that are it always going to be done the same way for a mother? Is she always going to protect her baby in the exact same way?
No.
And do all babies do all mothers protect their babies?
Yes.
You would hope.
Well,
Yes.
most.
And no, because there's some people out there.
I know,
Unfortunately.
yeah. And you have to think, what is wrong there? Why are they not doing that? That's what would be biologically normal. It seems like it goes against human nature. But there are people who aren't protective and who harm their babies, right? Who are neglectful of their babies for one reason or another. So because there's variation, this is not instinctive. An instinct is species specific. And when we think about instincts, it requires no learning. So here are some examples, like when a baby is born, it's going to root for a nipple, and it sucks. Now this is an instinctive behavior. All babies do this in the same way. It does not require learning. And it's so interesting because actually at about 34 weeks gestation, that's when babies develop this ability. So it's really universal. This means though too that if a baby's born before 34 weeks, they won't have that behavior in place. They won't have that instinctive behavior to know how to suck. And so they have to learn how to do it. And that's why babies born before that time would need an intervention to help them to feed, like a feeding tube. So there's this instinctive behavior is seen in every individual within that species. For us humans, all humans, same way. Now, I want to say too that there are another example of an instinctive behavior would be one that some of you may have heard of, and this is a behavior that was seen in I want to say they were ducklings. I think they were ducks, and there was an ethologist. Ethologist is someone who's studying animal behavior, and his name was Konrad Lorenz. And what he found was that when these little ducks, when the baby ducks were born, that soon after birth, after being hatched, they would follow the first moving object. And normally that's for the duck, who? Who's the first moving object for a duck typically?
The mama duck.
Right, the mom, right? Now, what Konrad Lorenz did is he wondered, well, I wonder if I replace the mom with something. I wonder if I replace the mom with a red ball, or I wonder if I replace it with myself. And so what he found was that when he, during that certain period of time, during, after the baby duck hatched, he found that that duck would follow the red ball, just like it would if the ball was its mother. And that it would also, if it saw him, if he used, did that as in an experiment, that the duck would follow him. And this was called imprinting. And so this is instinctive behavior. Another theory that is described in your book is called drive theory. And this is a very important theory in motivation. And it says that we have a drive to maintain homeostasis. So what is homeostasis? Do any of you remember when you think about the sympathetic nervous system and the parasympathetic nervous system? The parasympathetic nervous system is important for homeostasis. So that's where you learned about that word.
So everything is like kind of functioning equally and everything is balanced.
Yeah, exactly. So we're in a state of balance. So when you're really hungry, you're not in a state of balance, right? When you're really thirsty, you're not in a state of balance. When you're cold, you're not in a state of balance. And so when we deviate from homeostasis, this creates a physiological need that then causes a psychological drive to lead us to bring our body back to that balanced state that you just mentioned. So when we think about, for some of us, we have very specific things that we do to reduce that discomfort or to reduce that imbalance. So for example, this morning when I woke up and I had a cup of coffee, I felt like a little bit lightheaded and I wasn't really sure why. And so I thought, I'm going to drink some orange juice. And I tend to drink orange juice almost every morning. And once I did, I felt better. So what am I likely to do then in the future when I feel lightheaded?
Drink orange juice.
Yeah, I'm going to drink orange juice. So I've learned this, right? And for each of you, you have different ways that you tend to address that deviation from homeostasis. And so we develop this pattern of behavior in order to reduce the drive. And we then continue that behavior each time we've deviated from homeostasis. It's become a habit. And so in different cultures, like you see here, or different places in the world, people have different habits that they've developed. For this one young girl, she's eating watermelon. For this other young woman, she is eating sushi. And I'm not sure what the woman in the other picture is eating, but it's probably something different from what these other two people are eating, because she's developed a different habit to address the deviation from homeostasis. Another important theory in motivation is arousal theory. And so arousal theory says that we each have our own unique optimal level of stimulation that we function best under. So when you're really, really bored, you're not gonna do very well at whatever it is that you're doing, right? When you're really bored. Have you ever been really bored in a class or anywhere? And what do you feel like when you're really bored?
Tired. Like
Yeah.
I can't keep my eyes open.
Yeah, exactly. It's hard to keep your eyes open. So you feel tired, and your performance is not going to be very good. If you were given a quiz at that moment, you're probably not going to be at your best. You need a higher level of stimulation. Now, have you ever been in a situation where there's way too much going on and you're trying to learn? How do you feel then?
Like my head's gonna explode.
Yeah, Yeah. And for each of us, we have our own level of what we think is too high, right? Do you, what about you, Jacqueline? Do you feel like you can take on a lot of external stimulation, or do you feel like you kind of have a lower limit?
I feel like I have a lower limit.
That's what I thought when you responded very quickly and said your head's going to explode. I thought that. I'm the same way. What about you, Rashida?
Because I have to multitask pretty much all the time with the kids and stuff, I have a higher, but I do hit my limit when there's too much noise. So if I
Okay.
have a lot going on at one time, I'm okay. If it's too much noise and it's too loud, I start to kind of become overstimulated and ready to kind of, like Jacqueline said, my head gets ready to explode, and I'm like,
Yeah.
enough is enough. Everybody sit down.
How about you? I totally get that. Noise is the thing for me too. I'm that way. How about you, Vanessa?
I think I have a higher tolerance for a lot going on. I noticed though that when I do get like overstimulated with things, I like yesterday I was in my statistics class, and there was a lot of components to the chapter we were going over, and I just started like checking out. Like I got very overwhelmed, and
Yeah.
but like Rashida, I'm a single mom, so I always have a lot going on at the house. But there's a certain breaking point, so to speak. So
Yeah. So it sounds like for each of you, you recognize you each have your own breaking point, and we all do, right? And then for each of us, we have a different breaking point. And for each of us, we're uniquely affected by different types of stimulation differently. So like you were saying, Rashida, for you, it's a lot of noise that seems to affect you. And for each of you, Vanessa and Jacqueline, you may have other types of sensory stimulation that affect you as well. And I wonder too, when I think about what you were sharing, Vanessa, I think about, as you shared that there were so many different components to what you were being, what was being described, that was not only a source of external stimulation, it became internal because it felt, did you start to feel confused or a little worried or anything like that?
yeah, for sure, because we were learning things on the calculator, and I swear you had to push like 10 different buttons just to get the answer to one question.
Yeah, so what's happened is that you'll notice that the stimulation that we have, it's not only coming from outside of ourselves, it can come from inside of ourselves. So let's say, Rashida, let's imagine you have a pretty high threshold, but if you have a lot you're worrying about, a lot on your mind, then your threshold may be lower for external stimulation. Would you agree?
Yes. And I kind of attached that based on, like, when I was working in the dental office, I was the only assistant. So I had a lot of things to do at one time, but it was quiet because there was only 4, the dentist, dental assistant, hygienist, and office rep. It was quiet. There was only noise, like the sterilization going or something. So I could focus on many different things at one time.
Yeah.
But say, compared to being at home, and if I'm doing dishes, laundry, this is cooking, got to help them with their homework, and it's too loud because their kids will be kids.
Yeah. Oh, I know. Yeah.
Shut down, kind of like Vanessa said. I kind of start to like check out because I'm like, okay, I'm gonna like literally explode, and it's not even their fault. It's just me, So like, I feel like I can. I don't really know, actually. I don't know.
Do you, and when we think about arousal theory, I would imagine that each of you all, when you feel overly aroused, you try to find a way to reduce that. And that might be through, like, I know for myself, my kids they are, especially, they can be really loud. They're kids, like you said. And so when it gets really loud and I have a lot of things on my mind, or I'm trying to do something and it requires a lot of attention, then what I'll do is I will just say to them or just to myself, I need a timeout for a minute. And then that's a way to reduce that stimulation. Do you all do that?
Yeah, I tend to be like, guys, I'm going to be in my room for about 10 minutes. Don't knock on my door.
And that's so important and so healthy to be able to recognize that so that you can manage those uncomfortable feelings and be better for yourself and for the people that you care about. So you have to, recognizing that is so important. And you can see here that everyone's experiencing this. It's very, very normal. For kids, sometimes they don't have words to describe the feelings that they're having. And so they may just feel uncomfortable, and they don't, especially young kids, they don't know how to put that into a language that adults could understand, or even that is understandable to themselves. They just know it doesn't feel good. And so sometimes you'll find that kids who are overstimulated, they may have tantrums, they might act out, they might just sort of, like you said, check out, right? And so they're just kind of zoning out, not paying attention. And it can be misunderstood as a child who is choosing to misbehave or a child who is disinterested when they're trying to really just regulate that stimulation. So you can imagine how important it is for parents, educators, caregivers, if you're in healthcare and you're working with children or adult patients, how important it is to be able to recognize the different levels of stimulation. And when we think about being able to do well on a test or any sort of task, when we're overly stimulated, our performance is going to go down. When we're understimulated, it's going to be down. And we all have our own optimal level of stimulation. I've had students who've asked me before, do you mind if I wear something over my ears to block out the sound when they're taking a test? Because it's just too much for them and they need complete quiet. And for some tasks that are already complex, you're going to need even more, or you're going to need even more control over the environmental stimulation, because that complexity of the task is stimulation in itself. For easy tasks, we can take on less, or for easy tasks, we can take on more stimulation. We're fine with that. Does that make sense? I think this is important for, like, in the classroom, for teachers. I definitely think it's important. In early childhood, I think it's important. For parents, important. Healthcare, important. With patients, they're already overwhelmed by, maybe the sound of the dings and all the things going on in the room that are measuring their oxygen and their heart rate and their blood pressure periodically, and the nurses coming in and out, and then there's the prospect of what's going on with their health. And then when they're asked when they're told, this is the medication you're going to need to take when you leave, and they're overstimulated, they're not probably going to remember what it is that they need to be doing. So this is relevant in many ways to many areas. So we can relate this to what's called Yerkes-Dodson principle or law. And this suggests that task performance is best when arousal levels are in a middle range, and difficult tasks are best performed under lower levels of arousal, and simple tasks under higher levels of arousal. But again, we each have our own unique level of what we think is okay arousal for us. And what might be going on in the environment that we observe, we need to remember that's not the only source of stimulation. It may be perfectly quiet in a classroom environment, but if, let's say, a child is in school and their parents are going through a divorce, everything's quiet in the classroom, everything's nice and serene, but that is a tremendous source of stimulation for the child, which is then going to affect performance. Another important element of motivation is what we call self-efficacy. And Bandura said that self-efficacy is our belief in our ability to complete a task. And so motivation comes from the expectations that we have about how well we're going to be able to complete the task. So if I don't think I can do something very well, then I may not be very likely to do it. So when we think about, I'll use this example, when we think about in a healthcare setting, and we're asking someone, perhaps we've given them a set of instructions for some physical activity that they need to do to recover after surgery. Well, we need to make sure that the person has a sense of self-efficacy, that they believe that they can do this. And so that might involve practicing with the person. It's going to be involve reinforcing what the person's doing. It's going to perhaps involve checking in with the person and then reinforcing that behavior so that they feel as though they are effective in what they're doing. We also have social motives that affect what we tend to do. We have need for achievement, affiliation, and intimacy, and we vary on these along a continuum. Some of us have a higher need for achievement than others. Some of us have a higher need for affiliation than others, and some have a higher need for intimacy than others, depending upon our individual personalities, our individual experiences, and we could also factor in, let's go back to the level of stimulation we're currently experiencing. If I have a lot going on in my mind and I'm really overly stressed and I tend to have a low threshold for stimulation, am I going to really have a high need for affiliation at that moment? No. So, we can think about as parents or as teachers, you could think about how do you foster some of these, like how do you foster a need for achievement? What are we trying to help children to achieve? I don't know. I think when we think about today's education, so much is based on standardized testing. And for some kids, they could be so smart, but they might not do well on standardized tests. And so when they're not doing so well, could that affect their need for achievement? Could they feel like, I don't think I could do it? Could affect their self-efficacy?
Well, I think so, because if you think back to, or like for me, thinking back to whenever we remember those tests at the end of every year that we had to sit in the class at the desk. Can't think of what it's called. It's not the SAT or anything like that. It's like middle school and elementary.
Yes.
Not TCAT. But
I
you get
what it's called, but yes.
Yeah.
Yeah.
I used to get really bad anxiety because I feel like I did good all year, and then I'm like, all of that work will go to nothing if I don't make a good grade on this test. And then if it came back that I didn't make a good grade on the test, I just felt like, well, I can't do this. What's the point? So, I think definitely have an effect on their need for achievement, or they're feeling as if they can even achieve anything.
Yeah, and when I think about these standardized tests, like you said, they can cause a lot of anxiety, which can be overwhelming and can affect test performance. And two, the way that questions are worded can affect students and how they think about the question. They may not think about the question in the same way it was intended. And for some students, the nature of having a certain period of time that you have to complete it in feels overwhelming. And then we have to think too, just because that's what's being tested, does that mean that whatever's being tested is really a measure of what you've learned? You may have learned really great critical thinking skills, but maybe they're not testing that as much as your ability to just remember basic facts. And I'm not suggesting that that's what all standardized tests are measuring, but if we're using one that is really looking at like basic facts and how do you, like, what does this word mean? And instead of your ability to think and analyze, then you might not do as well. And if you might then think, I'm just not that smart, when in fact you could be really great at something that's not being measured, like you were saying, Rashida. When we think about motivation, we also, I think a big theory in motivation that many of you probably have heard of is Abraham Maslow's theory of motivation. And he said that we have a series of I guess you could say, like steps or levels that are on what he called a hierarchy. And he called this a hierarchy of needs. And he said that at the very bottom of this hierarchy, we have our physiological needs and our security needs. These are our basic needs. And when we don't meet those, we feel like there's a deficit. And we are most motivated to meet these if we don't have those met, it becomes harder for us to meet our social needs, our esteem needs, and our self-actualization needs. If we're given a choice between, let's say we haven't had food for 2 days and the ability to feel good about ourselves, like we've accomplished something, we're going to choose what? We're going to choose
Food.
food, right? And so these basic needs are going to become the priority. I think a misunderstanding that is often suggested is that you have to satisfy lower level needs. And it, you know, your textbook, I have this here because your textbook states this, but not all of the research on Maslow suggests this. And I want to give you an example and explain why. So let's imagine that, you know, think about many places in the world where people live in rather precarious conditions, where there may be war, there may be famine. And does that mean that they cannot meet their family or like their social needs? No. Right. I mean, logically, this makes sense, right? That it may be more difficult for them to be as good as they would be, but they can address those other needs. I think about people who are living in war-torn areas where there may be instances where I've read of women who've been, you know, in war who were sexually assaulted, and so then there are organizations, you know, or groups like support groups that other women may develop in order to support those women or to provide safety for those women. And those same women who are providing those groups or who are providing that support, they too don't have much food. They too feel vulnerable, but yet they're doing something that's very high level in this hierarchy. So that's, I think, important for us to note. And so self-actualization is our need to reach our fullest potential, to be all that we can be. And Maslow said that about 10% of the population reaches that. And it's usually older people. And that's because older people have had more time to get through these other needs, especially assuming that they've met safety and security, especially the social and esteem needs, where they don't really care if they're going to be recognized for their accomplishments. It really doesn't matter to them. They just want to be their own unique best. They, you know, they're no longer very concerned with feeling like they've really done well at something. They just enjoy being their best and doing well. And there's actually been an additional level to this hierarchy that's been proposed, which is called transcendence. And this idea of transcendence, which is above self-actualization, is where some people have gotten so high in their feelings of self and their characteristics of self-actualization that they help other people to become self-actualized. So they're so disconnected from their own need to reach their own potential or to be their own unique best. They're helping other people to reach their best. So I would encourage you to think about, where are you in that hierarchy? And I think too, when we think about children, and I'll use this as an example again, because when we think about human development, which was in the last chapter, I think around 16% of children, I want to say, and don't quote me on this, are living in poverty. And that's as defined by the federal guidelines. And there are many children who, they don't know where they're going to get their next meal. They don't know how. There are more children who are living in poverty than there are adults, which would make sense, right? Because one adult who may be living in poverty might have 2 children, right? And so I think about children who are going to school and don't have those basic physiological needs met. And as much as they want to meet those social needs and those esteem needs, and they may be motivated to do so, and can do it to some extent, it can be difficult. So we want to make sure that kids have those basic needs met as a society, just from a moral perspective, an ethical perspective. And safety too, if a child feels like their environment's not safe, their home environment or their neighborhood, their community. I wonder too with coronavirus, if children's safety needs, some of them have been affected outside of the effects of parents becoming unemployed and losing income. I wonder about children as they hear about coronavirus and their parents are saying things like, don't touch that, or you need to wash your hands. And it's like so often, right? Or we can't go to grandmother's house, can't go to her house because we don't want to get her sick. I wonder if that's affecting their safety, their feelings of safety. What do you think? For some children.
I think it affects children, but I think it can affect adults too.
Yeah. I think you're right,
think
Jacqueline. Yeah, I was only focusing on children because I was thinking about kids, but I think you're absolutely right. What were you going to say, Vanessa?
I think it really affects children. The whole coronavirus in its entirety is more so going to affect them socially. I know that my 4-year-old doesn't understand why she has to wash her hands so much. I try to explain to her what germs are, and she gets that they're something that's nasty, but affiliating it with being safe. I'm not sure if she can do that yet, but I definitely think it's going to cause children to be overly precautious about things in the long run.
I think that's a really good point. I think you have some, we could think about learning theories that you've learned about in an earlier chapter, and how we can relate that to how children are going to become, associate, how they're going to think about germs in the future, and how they're going to think about being in open public spaces and the risk. And then, I thought you brought up a good point, Vanessa, with how it might affect them socially, because they might not be getting the social interactions that they did before.
Yeah, absolutely. I chose to send mine back to school because I was fearful that they weren't going to develop socially, as I was able to as a child. So
yeah, I understand. I know my sons, they went back to school on August 3rd, and at their school they opened. They go to St. Mary's, and they were able to, they had an infectious disease specialist who came in and helped them to make sure that the desks were so far apart, and the kids were not allowed to come in to the into the building all at the same time, and they're not allowed to be in the hallway, different grades together, and they're doing everything they can. But I'm wondering, as safe physically as that is, how's that affecting kids, their feelings of safety? Do they feel more vulnerable when there's all these measures in place to control what's going on? I don't know.
I know. I think all of our kids are going to be hypochondriacs by the time they're teenagers because of this.
I think so. I mean, you think about each generation, each generation has their own sort of moment or period in time that shapes them. And for some, it's a much bigger moment or period of time. You think about the Depression, how that shaped the way that maybe your grandparents or great grandparents developed, how they view money. So like you said, Vanessa, how are kids in this generation, how are they going to view germs? And of course, nobody wants to get sick, and germs, protecting ourselves from that is a good thing, but within what, to what degree, to what extent?
So I'm sorry, are you asking Vanessa a question?
No, go ahead, Rashida.
I was going to say, I think that children in their moment of being children, I think they equate safety with their physical safetiness, not necessarily like being safe as in saying clean and, and not sick, so where they can, because I don't think about that kind of stuff. I think kids really think safety measures. So like, for instance, my kids are remote learning. Right now they're on their lunch/recess break, but they know that, they have to wash their hands. They have to cover their mouth when they cough. They have to watch what they touch, they have to keep their mask on when they go into the stores and things like that. And I think as long as they are with someone that they feel safe with, that they'll feel safe during this whole coronavirus thing. Yeah. Now for the children that go to school, I feel like, even though they have to keep their mask on, and they have to wash their hands, and they have to sit apart from their friends, and they have to, that's different, but I don't feel like they feel like their safety is in danger because they're somewhere that they're used to being. They're still at school. with their teachers. So I feel like even then, with them not being home, they still feel safe because their teachers are now taking over, like
taking care of them. I think that's a good point, Rashida. I think it is. I wonder, you know, when I know, for example, the reason I was thinking about this is that my son, he already tends to like worry about things. That's sort of his nature. He's kind of always been like that. And so he would say things like, oh, what if I get sick? Or, and I could see this little bit of increased worry. And so I do think you bring up a great point that it really is so important. The parents and teachers play such an important role in helping children to feel safe so that they realize these are just measures in place to keep you healthy. That does not mean that you're in danger. We're just doing things to protect you. So it's so much about how parents and teachers respond. That's a very good point. Whereas if you have a family member who comes to visit, or and maybe that person then is not typically around your child, if they are talking about their worries about the coronavirus, then that may bring in a whole different element, right?
And then the children will start to question you, like, well, Mom, well, they said this, that, and a third, and it'll kind of put a little bit of like a dent into their solid safetyness, is what I like to try to think.
Yeah, I think that's a very good point. So it's so important that adults are very careful about how they communicate. And it's not that we're not wanting adults to be honest, but to to communicate in a developmentally appropriate way so that kids do feel safe. So another area of motivation that I think if you haven't read the chapter yet, that you don't have to have read the chapter to know that an important area of motivation is eating. And so we're all motivated by this to a pretty significant degree, of course, because it promotes, it's important for survival. We have to, and we're even motivated to eat certain types of foods more so than others. So we like foods that are sweet. We're wired to like them. Even as babies, babies like sweet foods, and they will make a face that shows a sense of dislike to things that are bitter or things that are sour. And we like this because we need sugar. Now, not refined processed sugars. We need something sweet like what you would find in fruit. And that is going to be important for, and of course, fruit is important for nutrition. So we're wired for that. And we're wired to like things with fat. Actually, they found, I think, that human beings like, on average, about 28% fat in their food. That's kind of like the level that is most tasty for people. So we're motivated to eat those things, and it makes it hard to avoid them. So let's take a look at the underlying physiological mechanism. So there's a complex interplay of mechanisms that are taking place that are related to hunger. And several years ago, there were some researchers who wanted to understand what it is that compels us to eat, what it is that makes us feel hungry. And so what they did is, and interestingly, because they couldn't get participants to be in their study, they decided that they would be their own participants. And so what they did is one of them swallowed a balloon while the other one inflated the balloon while that balloon was in the other guy's stomach. And they wanted to know what would be reported. This sounds like some realistic. This really makes me think of like a fraternity party that's just gone really wrong, and so it should have never happened. But what was interesting is that, when you think about it, what they were trying to mimic is that feeling of having a full stomach and then the feeling of having an empty stomach. And so because when they expanded the balloon, the guy said, "I feel hungry." This then led them to, I think it was Walter Cannon, I'm not sure, don't quote me on the names of the people, but one of them, the guy who had swallowed the balloon said he felt full. And then when the balloon would contract and the air was released, he did not feel full. He felt a sense of hunger. And so then they concluded that it must be the stomach that's making us feel hungry. Well, as you probably know, it's not the stomach that makes us feel hungry. There's a lot more that is going on than just what's going on in the stomach. Even people who have their stomachs removed because of having cancer, for example, they feel hunger. So there's more going on than that. So When we have an empty stomach, there's that physical experience, right, that we have, and we have hunger pangs that then result in, in the secretion of chemical messages that travel to the brain. But see, this is not the only thing that's going on, as you can see here. We also have low blood sugar levels. And then the pancreas and the liver generate chemical signals that cause hunger and initiate feeding behavior. So you can then, when you think about low blood sugar, you can think about how low blood sugar can cause people to eat a lot more than they might normally eat because they're trying to get that blood sugar level back up. And if someone is pre-diabetic and has hypoglycemia and they're frequently having fluctuations in blood sugar, they may not have healthy eating behaviors. They're eating at time, they're not eating consistent times of day, and they might not choose the healthiest foods in order to alleviate that discomfort. These are just, so this is before eating, and these are just a couple of the things that are going on. There's a lot more going on that I don't expect you to know in this class. I'm just sharing with you what is what's important for a class like Intro to Psychology. Now, after we eat, we have a feeling of fullness, and so here's what's happening. You have an increase in blood sugar levels, and then the pancreas and the liver, they send signals to shut off hunger. Then you have food passing through the gastrointestinal tract, and we have these satiety signals that are sent to the brain. Satiation, satiety, that is where we feel full. Now, fat cells release something called leptin, and this is a hormone that lets us know that we're full. So in some people, they may have abnormally low levels of leptin, which make them then, it causes them to not have the signals that a typical person would have when they eat. So then they're eating more than what they would need to eat. So they're not getting that signal. So you have leptin as an important hormone. There are brain mechanisms, of course, as well. And we talked about the role of the hypothalamus. Do you all remember that? And the hypothalamus is important in overall motivation, but one thing it does is it's important in food intake. And so in rats, when they've taken part of the hypothalamus, when they've lesioned part of the hypothalamus, and it's part of it that's called the ventral medial hypothalamus, that the rat will just continue eating, and it will just get so large, and it just doesn't get the signal that it needs to stop eating. Whereas if you lesion another part of the hypothalamus, the rat will literally starve itself to death. So that's just this is another, so I'm just bringing this up to point out that there are multiple components to hunger and to feelings of fullness. So when we think about body weight, most of you all are aware of metabolic rate, and you know about gene-environment interactions. So you may have inherited the predisposition to have a certain body weight. Let's say that a male inherits from his parents the tendency to weigh between 160 and 200 pounds. If he is not eating very much, or if, or let's say that he's under a lot of stress, he may have a lower weight. He may be on that lower end. Whereas if he is eating a lot, or if he's and he may stress eat, might be a different way of responding to stress, then he might be on the higher end of that weight. So we all inherit not only this tendency to weigh a certain amount, this sort of range, but we also have, some individuals have a higher metabolic rate than others. And this, of course, can be affected not just by our predispositions, but it can be affected by the types of food that we eat, and also the amount of muscle and fat in our body, the distribution, and it varies between people. And many of us want to know, how in the world can we just increase that metabolic rate so we can eat whatever we want and not gain weight, right? So there's a theory that's called set point theory. And so we each have this weight or set point that is resistant to change. And some of you may have noticed that in yourselves, where no matter what you do, you tend to stay right around a certain weight. Maybe you gain weight if you over the holidays, but when it comes time to trying to lose weight, you kind of find that there's this spot where you just stay at, and it's difficult to get lower than that. And we might think of that as being related to our set point. And so this is, as you see here, it's resisted by those changes that we try to make in how much food we consume and how much energy we expend. An area of interest to you in the field of psychology, and of course in many other fields, is obesity. And many of you know what a significant issue that is and how many health issues are associated with obesity. So 2/3 of US adults struggle with issues related to being overweight, but that's not that many people are obese, but you can see 2/3 are struggling with issues related to being overweight. And of course, the obesity rates vary by state. And many of you know that there's a certain region of the country that seems to have higher obesity rates. Where would you guess that is?
The South, because all the fried food.
Yeah, yep. It's the South. Yeah, it's the South. And so you have, like you said, fried food. You've got cultural variables, right? And the cultural variables are, you know, you go to someone's house, they're fixing biscuits and gravy. You got fried chicken. You know, you have all these foods that are typical, like almost staples in many households, right? And then you also think about, too, that there are certain parts of the country that have higher rates of poverty. And there are higher rates of poverty in the South than in many other parts of the US. And we know that it is difficult to have access to all the healthy foods you need when you are poor. So if you don't have very much, you know, if you've paid all your bills and you've got X amount of dollars left for food, and you've got to make a choice between fresh fruits and vegetables or a prepared frozen meal, and that is that's much more highly processed, but also very dense in calories, you might choose that. So, you know I've been to Kroger, and you'll find like that, you know, sometimes the frozen foods, I've seen carts where they'll be really full with lots of frozen food meals. And then I notice when I look at the circular that there's a big sale, and that, you know, you're talking like $2 a meal. So, I mean, if you've got a big family to feed, or even not a big family, but, you know, when you're making the wages that we have in this country that do not really support, they're not living wages, then you can't necessarily eat as healthy as you would like. So poverty is a big factor. And then too, if you're living in a poor area, your environment it's not going to be as conducive to physical activity. You're not going to have the infrastructure that promotes physical exercise. So you're not as likely to have all the neighborhoods with the nice sidewalks and the walking trails, and your neighborhood might not be as safe, so you don't go outside to get the exercise that you want. Or if you do want to exercise and you need to go to a gym, then that's an extra expense. So those are important variables too. And there are also environmental factors that, like I mentioned, additional environmental factors that are related to obesity outside of the socioeconomic status and the physical environment. I think too that for some people, they may emotionally eat. So they have stress in their home, or they have you know, a history of having trauma in their life. Then food becomes for some a way of dealing with that trauma. If you've ever watched programs like My 600-Pound Life, which can be so sad to watch, and the you know, it's not as though the people who are eating are just on their own loving to eat 3 whole pizzas. It's not like it's just because they like eating. There's stuff going on underneath that, and there may be codependency. Yeah, Rashida.
I am addicted to that show. Okay.
Are you?
Yes. Okay. So I've been up and down with my weight literally through all of my life. And it's funny we were talking about that, because I feel like I have like a predispositioned number that I stay around.
Mm-hmm.
But in college, I got way down, like the least I've ever weighed in my life. And I kept that until I got pregnant. And as soon as I got pregnant, I zoomed up, and I was fearful of that. So I made sure I didn't eat a lot of sugar. I made sure I stayed active, which I wasn't like working out hardcore, but I would stay walking, and I still gained, with Caden, I gained 92 pounds. And then I got about 50 pounds off. And then 6 months later, I got pregnant with my second son, Keno, and I only gained 42 pounds of him. And then for years I had to go back to school and do this, that, and the third. So I didn't have time to focus on my weight, right?
Yeah.
So I didn't gain, but I just kind of stayed stagnant. And then I started losing weight, and then I got pregnant with my youngest son, Cameron. So right now it's like, okay, I want to lose weight, but I can't focus on that. So I'm kind of staying at a stagnant number.
Yeah.
Now I started watching My 600-Pound Life because initially it was to keep me from eating, to keep me from overeating, watching, other people struggle. And I don't know why, but watching them struggle with their eating, not necessarily their weight, which they, of course, are struggling with their weight, but it was the eating part. Because for some reason, it kind of like drowns out your sorrow. Some people eat their emotions. So to prevent me from eating my emotions, I'd watch that show. But as I watched the show, I started to realize that there's so much like deeper issues that they're facing, like with, like you said, psychological things, like, they're dealing with trauma, abandonment, and they found food through that, and they didn't realize like they got as big as they did.
Yeah.
And I started, after watching it for, 2 years, I don't necessarily watch it now because I'm interested into keeping myself in check. It's more so I watch it because it's great. I like to see the transition. Now, some of them don't, unfortunately, but some of them do. And the psychological, like their brain clicks, so it's different now when I watch it than from when I begin, but I'm addicted to that show.
I think everyone should at least watch the show one time, because it can help to give some insight to people, especially when we have so many people who, I don't know how many, but it seems like so many people are very judgmental of someone who gets to 600 pounds. And they say, well, why don't they just not eat? Why would they let that happen? Well, none of the people on that show want to be 600 pounds. It's not that they lack willpower perhaps in other areas of their lives, but in that area there is something that is triggering that. And then I wonder how many people who have gotten to that point have wanted to exercise and make good choices about physical activity, but maybe they didn't because they feel pressure from society that they don't look good enough to go to the gym, or people are going to judge them when they go on a walk. So I think it's a really good show, and it's good, and it really can help people to understand the challenges that people experience. And you all know that there are so many health risks associated with obesity, including cardiovascular disease and stroke and type 2 diabetes and breast cancer, infertility, arthritis. And your textbook goes on to describe bariatric surgery. And I'm not sure if, I don't know anything about how, if insurance covers that. Think about, not everyone has access to this means of trying to address their weight. So it's interesting for sure. I don't know if like public insurance, like if you're on Medicaid, I have no idea if that covers that, or regular health insurance, but it can be difficult for people when they get to that weight to lose it. Yeah.
Yeah. So a couple years ago, I was looking into the vertical gastrectomy thing. It's not the bariatric, or it is bariatric surgery, but it's not the big one where they cut out like your whole stomach. It's like where they cut out some of your stomach. SG, I think is what it's called, the vertical sleeve or whatever.
Yeah, yes.
So whenever I worked at ETSU in their dental clinic, I had gotten Blue Cross Blue Shield. So before that, I was on the Medicaid or Medicare, whichever one they give when you're on assistance. So whenever I looked into it, when I had that, I was told that I had to be in like a 6-month weight loss, basically. They want to watch what you do for 6 months to see if you're going to lose the weight. And it doesn't give you a set number, like you have to lose 100 pounds or something. It's more so they want to see for 6 months if you'll lose the weight and if you fail.
I see.
Then for Blue Cross Blue Shield, when I looked into it, they didn't have any like pre-stipulations. The only thing that they required was that you do a psychological eval.
Okay.
And you had to get that signed off, and then you had to do a consultation first, and then you
Okay.
pay a portion before they approve the thing. So like for instance, the one that I was gonna get, I think it cost like around $8,600, and I had to pay like out of pocket, I had to pay like $35.
Yeah,
For
that's a lot though.
Yeah, so that's why I was like, oh, I think I'll just try to do it on my own at this point.
Yeah, yeah. So even if insurance is covering it, that's a lot. Yeah,
It's
that's
a lot of money, and I know it. Yeah, it's difficult, and I've thought about it, but it's just like I'm gonna starve anyway, so I might as well just do it now, and I'll have all of my stomach to eat later on in life, you know. So
Yeah. Yeah, it's expensive, but it is good that they're covering part of it. That's helpful. And I appreciate you sharing that. I've heard of that. I think I've heard of that on the show, My 600-Pound Life.
Yeah,
That's what I heard it mentioned.
There's all kinds of different ones. There's the gastric bypass is what it's called, and then the RFI, and then all that, and then there's the where they like cut off some of your soft. I don't know. It's just too much for me. I'd rather just go on a caloric deficit and just fight through those hunger pains, because it's just, some of them are a lot more expensive. I think for a gastric bypass, that's like 11 grand. So
wow. Yeah.
it's pretty expensive.
It's very expensive, big commitment. And then there's risks associated with any surgery. So so we know that there's, and we know that there's lots of health risks associated with obesity, but it's not always so easy to lose the weight. And it's certainly not an overnight or a very quick fix. It can take quite a long time. But I'm like you, I like seeing the before and after, Rashida. I like seeing that. I wanted to also talk about eating disorders. And I think what we'll do is I'm going to this will be like part 1 of chapter 10, and then I'll have a recording, or we'll do next week, of part 2 of chapter 10. What do you think about that? Does that sound good? Okay, so let's look at eating disorders. And these are not the only eating disorders that are identified as or recognized as eating disorders by what is called the American Psychiatric Association, but these are 2 that I wanted to first bring up. And the first is bulimia. And bulimia is where someone is engaging in binge eating behavior, and then they will try to compensate by getting rid of that food. And so they might compensate by vomiting, abuse of laxatives, excessive exercise, abuse of diuretics. And there are lots of different health consequences of this that can include kidney failure, heart failure, tooth decay. I've heard of rupture of the esophagus. And there are also comorbid meaning that disorders occurring at the same time with bulimia oftentimes, and that includes depression. There's an increased risk of that, and anxiety, an increased risk of substance abuse. We'll look here in a moment at some of the factors that contribute to these disorders. And then anorexia, and most of you are familiar with that as well, where a person is trying to maintain a body weight that's below average through starvation and exercise. Now, to be diagnosed with anorexia, I think you need to be 85% of what your recommended body weight is for your height. And for women, you need to have cessation of your menstrual cycle if you're of childbearing age. So I think that those are important criteria, if I'm not mistaken. So it's not just trying to be thin, it's where you are, so you're already at that weight when you're diagnosed with anorexia, and there's a distorted body image in addition to that. There can't be other causes of this, like something that is going on in your brain that's causing you to do that, like we talked about the hypothalamus, or it can't be because of medication that you've taken that's caused you to lose weight unintentionally. There are lots of health consequences like bone loss, heart failure, kidney failure, and then of course cessation of your menstrual period, reduced function of the gonads and of the ovaries. We can think about how this can affect fertility as well, and in some instances it can cause death. Now, anorexia and bulimia, and eating disorders in general, they, it's very common when they do start to happen around ages 15 to 19. But there are many instances where younger kids will develop eating disorders as young as like 7 and 8 years of age. Just like bulimia, there are these comorbid disorders that occur with them, like anxiety, mood disorders. Mood disorders would be like depression, and then substance abuse. And you can see here, the highest risk group tends to be Caucasian females around ages 15 to 19. And there are contributing factors that make women in particular more at risk, but this is also, I think around 10% of those with eating disorders are men. And this is in this country. So the media is an important factor, but if it was the media, then probably everyone would have an eating disorder, right? Because we all are exposed to the media. So there's other factors that make us vulnerable, that make some people more vulnerable than others. So genetics may predispose someone to the development of these disorders, low self-esteem, having the comorbid disorders like depression, life transitions and stress. So in adolescence or in childhood, parents going through divorce, that's a form of a stressor. Experiencing bullying or abuse, having perfectionistic personality tendencies. Also, I want to point out too that when you think of bulimia, there can be this sort of, it's like a battle between your need to eat, and especially if you have depression and you feel like, and for some people when they have depression, they will eat a lot. They'll eat more than if they didn't have depression. For others, they don't. But for those who maybe are depressed, or people who just perhaps have a great appetite, then you have that, this feeling of intense hunger or wanting to eat, and then you have the anxiety that you experience when you eat that much and you think about how you think your body should be because of media messages.